Should we see a psychiatrist or psychologist? I think the first thing to stress is that those are not mutually exclusive healthcare professionals. Often, if we think about mental well-being and mental health, it could be a psychiatrist where a lot of, apart from assessment, what we do is often things around medication, treatment from that framework. It could be a psychologist, which it could be things around talking therapy. It could be psychological interventions from that perspective. It may not be either of us. It may be some other framework which we have to think about in terms of your mental well-being. Is it social aspects which needs to be taken into consideration? So asking that question is challenging because it's very much guided by you as an individual and the discussion which we have during our initial consultations and after as well. For some people, yes, they're saying, look, I'm not looking towards medication, I'm looking towards more talking therapy. Then it would probably move to psychology later on down the line, or vice versa. Some people say that I'm not ready yet for psychological therapy, I'm thinking of medication at present, and so that's often guided by the individual.
A thing that people sometimes wonder is what's the difference between a psychiatrist and a psychologist? Psychiatrists are medical doctors, so we will have come from a general medical background, and therefore we will be thinking about physical as well as mental health. And generally, psychiatrists will be forming diagnosis and prescribing medication. We don't all prescribe medication for everything, as in we don't always think medication is required, but generally, if someone is prescribing, it would be a psychiatrist who does it. So psychologists are generally not medical doctors unless they're medical psychotherapists. And the psychological approach is really much more about talking with someone and thinking, what are the difficulties you're experiencing? And are there certain techniques or strategies that you could use to manage those? Or are you perhaps trapped in certain patterns of thinking which are really hard to shift? A psychologist will really be trying to work with you to think, are there different ways that you could think about situations and different behaviours that you could adopt to manage situations so that things don't feel as difficult as they have before?
What we would suggest is you initially get an assessment with a psychiatrist. This is because we can take a robust, comprehensive assessment on what your needs may be. And then following from that, and again with discussion with yourself, decide where we move forward from there. It could be psychology, it could be psychiatry, it could be some other framework as well. I think the important thing to stress about Sloan Court Clinic is that there is joined up care. Often within healthcare services, it feels as if things are siloed out, where you go to one individual for something and then you go to somebody else and then nobody talks to each other. What Sloan Court looks to do is try to reduce those barriers between communication. And by sitting under the same clinic space, and because a lot of our colleagues are people which we do meet, this could be helpful in trying to break down some of those barriers in communication.